My name is Megan Ellison. I am a registered dietitian nutritionist. I'm also a certified diabetes care and education specialist. I have 2 degrees in nutrition. Both my undergrad and my master's degree were in nutrition. And I also have additional training specialty in adult weight management. Besides, dietitians are kind of the gold standard as far as weight management, but then I've gone on for additional training in that, and I've been in practice for over 15 years now. And so a lot of the patients that I see, we do work on weight management. That's our topic for tonight. And I'm going to give you a few of, my tips and things that I tend to see. Oh, someone says no slides. Interesting. In the Q&A. Hmm. Okay. Hopefully, Barbara, that's interesting that you can't see the slides and other people can. I can try and reshare them. And it looks like I am sharing. So, hmm. Okay. Looks like the majority of you can see the slide, so that's good. Fantastic. So this is our topic for tonight, and feel free to put some questions in the chat or the Q&A. I will check those occasionally. And we're not going to get to all of the nitty-gritty, but we're going to, touch on the big things and the things that you really can start controlling this year, moving that dial, moving that needle, hopefully in a really positive and healthy and joyful way, ideally. Because I know that this topic can be, pretty emotional, actually. There's a lot going on, and some of this has been decades in the making, and you might be very frustrated at this point as far as weight management goes. I totally hear you on that. I have lots of patients who are in that boat. And, sometimes the knee-jerk reaction is to try and like do it all and be perfect, which we're hopefully going to address and like, get you to think about more realistic incremental shifts over time tonight. But yeah, feel free to put any, specific questions that you have or things we don't get to in the Q&A and chat. I am going to stop share and just see if I can try this one more time to figure out why you guys are not seeing. I'm going to share a different. I think that's better. Hopefully that still works for everybody. Okay, we're going to do a quick review of the stats and correlation. Why does this matter? Getting off the merry-go-round, as I call it, with the different bad diets. We'll talk through behaviors that actually work and some common pitfalls to avoid. We're going to touch a little bit on some nutrition and medication interactions. Like if you are on medication specifically for weight management, what are some things that you should be thinking about with regard to that? We'll talk about practical strategies. I will share these slides with you, so you'll get them through Stilly Valley probably tomorrow. And I'll send you probably a couple other handouts as well. So we'll just see what kind of comes up over the course of the next hour. If you don't have a piece of paper and a pen, please get one. Because ideally you would jot some things down as, ideas come to you. I'm going to actually have you set some goals at the end and develop an action plan. Like, what is your first step? Okay. All right, here are the stats. Basically, only Colorado is the state that is left with that doesn't have 25% or more of their population self-reporting as having obesity. So we know this is an epidemic, and it has been, progressively becoming worse and worse over time. That's not new to anyone. And it does impact especially cardiovascular disease risk. Of course, I also work in diabetes, so I see the correlation with diabetes, which is also a risk factor for cardiovascular disease. But the reason we kind of focus in on heart stuff is that that still is our number one killer in the US. And we do have strong evidence showing that reduction in body weight can improve your risk factors like high blood pressure, high lipidemia, hyperlipidemia, or high lipids like high cholesterol or high triglycerides, hyperglycemia. So whether that's pre-diabetes or diabetes, or maybe it's even just like post-meal rises in blood sugar after the meal. So keeping, your blood sugar under control. And I want to point out this little blurb right here about sustained weight loss of 3 to 5%. That's a tiny, tiny amount. So just in your head, stick that or write it down, 3 to 5%, and then you can figure out what that is for you. 3 to 5% has clinically meaningful health benefits. Of course, more, you'll get more benefits. But a lot of times we have such high expectations, and there's so much like social pressure and things out there giving us unrealistic expectations about what to consider is a good and healthful weight loss trajectory and rate, which we'll address tonight. But a lot of times, my patients come in and they're feeling bad that they've only lost 10 pounds in the past month. I'm going, that's right on track. Like, we don't want you losing more than that. Right. So sometimes it is shifting that expectation so that you will stick with it and you will not just throw in the towel and, stay the course with this. And then, of course, we know that during the pandemic, we saw poor outcomes for people who had obesity at the same time. And it wasn't just about weight, it was about the type of weight, right? So it was that visceral adiposity or that central weight, basically, the fat that is around the organs in the body that we know is more pro-inflammatory and does cause more insulin resistance. We saw poorer outcomes with that. And so it's not just like weight, it's what kind of weight and where is that distribution of weight, because we really want to target that central or visceral adiposity for lowering risks of disease states. Okay, so those are some of the like whys from a health perspective. Like, this does matter from a health perspective, but that's not your why, right? That's not your reason for making changes. That's not your reason for staying motivated or for getting up to do your exercise routine in the morning or, eating your broccoli. You got to figure out what your why is. And there's this saying, why until you cry. So basically, you ask yourself, why are you doing this or why this goal until you really get to the heart? You just keep asking why until you get to the heart of what is your real thing? Like, what are you really going for? Right. So, a lot of my patients who are coming in that are, in the grandparent age, excuse me, I need my water, are saying, well, I want to be active to be around with my grandkids. And that is amazing. And then we ask, why again? And, maybe it's because you have things to pass on to them, or you really want your quality of life these last few years to be really, really meaningful. It gives you purpose. Or you're helping your kids out, right? You're seeing how that's helping, that generation and the next generation. Um, there's just so many different reasons, but a lot of times it does come back to like the social interactions. For sometimes it's for people who want to travel. It's that where they're traveling with a partner, they're seeing the world, they're expanding, their horizons. But what matters to you really does matter in your big picture of how are you going to stick with this? And you want that why to be written down. You want it to be in front of you. Put it on the, bathroom mirror, wherever you need to stick it so that you will keep seeing your why. And maybe it changes over time, but if you really get to the root of it, it probably is going to be a foundational thing for you. And so that why will stay the same. So why until you cry? That's going to take maybe a little bit of, time to think through that. And I would encourage you to write it down. Okay. There are a lot of options out there. There's a lot of information and a lot of misinformation. And there's a lot of um, approaches and books and plans and programs that will say there's just one way. That's it's our way, right? Do it this way. But we know that that is not actually true. We'll look at some of the things that overlap and some of the things that do work for people. But let's talk about some pros and cons because probably some of you have been through these various diet plans. Usually, they're pretty restrictive. So I will say right off the bat, you do want to think about like, is this sustainable for me or not? And sometimes you're looking for just a little jump start, and that's okay. But again, we want to set those expectations for what are you going to be able to do for the long term for your health and keeping not just losing weight, but keeping the weight off. So let's just talk pros and cons a little bit about a few of the ones that are out there. These are some popular ones lately. So keto has been around for a really, really long time. The pro that I would say about this is it's all about like reducing carbohydrates. And so, the outcome of that means you're also reducing added sugars. So like refined added sugars. It's demonizing carbs though, right? And it's putting all carbs together. So like whole grains that are really healthy, nutritious, or like fruit, which we know we get a lot of vitamins, minerals, fiber from. So it's really lumping all those carbs together because from a keto perspective, if you're going to be in ketosis, you have to be really, really low in carbohydrate. And we do know because dietitians have been using keto diet for over 100 years to manage really uncontrolled epilepsy situations. We've been using that for a long time, and we know that it is not a well-rounded diet, right? And we know that because kiddos have a hard time with growth and development because it's not nutritionally balanced. So, the other con of this is it's really not a balanced plan where you're getting all your micronutrients. You're going to need to supplement with it. And for some people, it means like they can't continue doing their exercise routine, for example, because you're so low carb, which is our fuel for our cells, especially when we're exercising, that's affecting your activity side of things. And if it's affecting activity, that might be affecting your long-term trajectory of being able to keep that weight off. There's a high attrition rate, or basically people drop off of following keto. A lot of times due to the fact that there's, some negative GI side effects, higher risk of gallstones, diarrhea from fat malabsorption, because it is a very high fat plan. It's not a high protein plan. Just want to clarify that for people. This is not paleo, which we'll talk about in a minute. This is keto in the sense of like it is 80% or more fat. So it's mostly fat in the diet. That's a true keto plan that actually puts you into ketosis. So, there's going to be serious cons to that plan. And for some people, it actually is life-threatening. I've seen people in the ER with acute renal failure because they were on keto and tried to do exercise. They tried to do CrossFit while doing keto and basically liquefied their muscles to the point of having acute kidney failure. So there are some, serious risks with some of these plans. So just, know that it's not without risk. 3010 Weight Watchers Noom. The thing I like about some of those, especially like the ones with the apps, is coaching support, structured plans, the online check-ins, motivational check-ins, recipes. Some provide meals, some do not. But the cons would be things like cost tend to be pretty high. Sometimes there are unrealistic claims or expectations, although they're getting better. Like especially Weight Watchers has gotten a lot better about being very healthful minded and not just physical minded, but like mental health minded as well. Um, but some of these do still have some harmful food body messaging. So for anybody who already has like guilt, shame, or eating disorder type tendencies, um, it can be not necessarily the most supportive thing. With paleo and Whole30, you're looking at basically a lower, not super low like keto, but a lower carbohydrate intake. And the nice thing is there's an emphasis on whole foods and plants. There's an emphasis on reducing processed things, reducing sugar. So you're really going more towards like ideally like a whole food diet. And some of my patients have used these diets, like come out of these paleo and Whole30 diets, basically saying, oh, I felt so much better. And that actually was the red flag or the impetus for them to see a dietitian to go, why are carbohydrates making me feel bad? And then we figured out, oh, you have an intolerance to one of these, especially a fermentable carbohydrate, like an intolerance to fructans in wheat, for example. So sometimes it's like the start of addressing bloating, gas, GI concerns, where we can then do some digging and figure out, which of the foods are actually causing symptoms. So it's sometimes helpful, for me as a clinician to have people who have been through some of these things already because they've had experience with it. And then we have basically like a head start on, figuring out what their GI concerns are. But again, it's not like a nutritionally balanced long-term plan. And with these two, especially, there's a lot of negative messaging. And especially with the Whole30, when it first came out, maybe it's a little bit better now. But there was some really harmful food and body messaging. So do be careful about that because some people, really are more susceptible to that messaging, and we don't want to be harming at all. We want to just be supporting, and your mental health is your health. So, that matters as well as you're going through these, changes that you're making to your life for your physical health. Intermittent fasting is a big deal right now. There's lots of different plans. 5-2, 16-8, alternate day fasting, weekend fasting, once a month fasting. And then, of course, we have religious fasting in certain religions. And so this is basically like you're taking short periods of time where you are eating and other periods of time where you're not eating. Sometimes, that time varies just depending on what the plan is. We don't have really long-term studies of chronic fasting, but I will tell you that when I have my patients come in who are newly diagnosed with diabetes, usually they are the people who are skipping breakfast, maybe skipping lunch, and eating most of their calories in the afternoon, evening, up until like bedtime. So it's people who have already been doing quote unquote intermittent fasting for decades, which actually plays into the pathophysiology of type 2 diabetes. So doing this short term for like weight loss is a very different thing than doing it long term as a lifestyle. Because when you are fasting long periods of time, where do we get our fuel from? If you run out of carbs, you're going to start making sugar through a process called gluconeogenesis, where your liver is and other kidneys and other organs are basically ramping up sugar production, and we get that from breaking down muscle, right? So I don't want you losing any muscle. We're going to talk about muscle in a little bit and how important it is. But in this process, we really want to be supporting muscle gain, not having muscle loss. So, be careful with intermittent fasting when it is too long and you're really tapping into muscle stores, or it's too chronic, like you're doing it too often, where you're basically training the body to tap in to muscle stores. And I would also caution for women, especially women who are postmenopausal, we see more muscle and bone density issues, more losses with long periods of fasting than men do. So we really want to be careful. And most of the studies have been done with young men, most of the fasting studies. So we want to be careful with that. Of course, like when we look at the research and do comparisons, there's really no greater weight loss with fasting compared to just overall reduced calorie intake. And there is a higher attrition rate because people just find it not as sustainable. And then we do see some of that metabolic adaptation over time where you're basically kicking out extra glucose out of your liver because of not fueling with actual food. So, pros and cons, what's going to work for you is not going to work for somebody else necessarily. But if you've been through some of these different plans or if you've tried other things in the past, I would take, what you learned, take the wins, take the things that really resonated with you from some of these things. Like, maybe you do really need more protein, for example, or maybe that really helped you with more fruits and vegetables and fiber. Maybe it was a structured plan that was like, mini meals, like small eating instances, a structured schedule over the day, and that really worked for you. So I would, figure out what that is for you and what's going to be supportive because, we don't have a holy grail. We don't have just, one plan that is going to fit for everybody. And, you are not your friend or your colleague or your mom or some random social media influencer. So what works for them is not necessarily what is going to work for you. And it's, not just our environment, but it's also genetics. It's also hormones. It's also our gut microbiome. And that is being highly affected by all of the toxins are in our environment. And then it's things like age, our status, especially for women in that peri to postmenopausal age range. So we really got to, kind of focus on what you can do and what you can control because there's so much going on that you can't control, like age and genetics, for example, and identify the strengths so that you can focus in on those and use those for your benefit. So here are some of the successful weight loss strategies from people who have lost weight and kept it off. This was actually a meta-analysis, so a review of lots of different studies. And basically, people were eating less, exercising. Some of them specifically ate less fat because fat is a very calorie dense, in a small amount, is very calorie dense. So that adds up pretty quickly compared to carbs and protein. Some people switched to foods with lower calories. But what was not associated with successful weight loss were popular diets, liquid diets, weight loss pills, and diet foods or diet products, looking at the long haul here. And I put the merry-go-round on here because this is kind of how I think about it. Like when you are someone who's, been tapped into the popular diet culture, it's like you're on the merry-go-round and you're picking a different horse thinking that you're going to go somewhere else, but you're just like in a circle. We want to get off the merry-go-round and actually do the things that really are going to help you make changes in the long haul. So we do have a literature review that looked at, what does work. Lots of different dietary approaches work as long as they had actual energy deficit, right? So we're not going to overcome the law of thermodynamics. You do have to have a realized energy deficit. But then in addition to that, we want to be addressing not just diet, but also exercise and behavioral therapy. So this mental health component of things. And that is the piece that I have found with my patients, at least. A lot of them come in really focused on food and exercise and not really addressing depression, attention deficit, other mental health concerns that are actually getting in the way of making sustainable long-term changes. So we really want that three-pronged approach. So you're really getting at all aspects and being supported from those three different areas. And then what else was found in the literature review was that it wasn't just like the intervention, but the frequency of intervention was really important. So what they found was basically like intensive treatment. So if weekly for the first month, check-ins either with a professional or with a group, and then biweekly for months 2 to 6 and follow up, thereafter was associated with more success because those check-ins and that accountability did make a difference. So, sometimes that's the other thing is like, who are you being accountable to? Do you have a support system? Are you seeing a professional? Um, and if not, you've got access now to a dietitian. I'm sure you have a gym or a personal trainer or a PT if you're in physical therapy, um, where you could have some support with the exercise side of things. And then if that mental health piece is the missing piece, then I would think about that as well. There's a question here that is says, what is meant by energy deficit? Energy deficit means that you are taking in less calories than you are burning. So you could do that lots of different ways, either like from food or from increased exercise or from both, a combination. But basically, you're taking in less energy than you're burning on a daily basis. So it's a net deficit. Okay. Here is what is recommended from from the lifestyle preventive task force guidelines for Americans, so lifestyle therapy for weight management. Reduced calories, that's that energy deficit. Not too much though. Like we don't want to go too low. Call it like the Goldilocks zone. It's not too much, but it's also not too little. It's just the right amount spaced over the day. Because if you go too low, you will have more muscle loss. And then we do see that metabolic adaptation happening. And also the meal plan should be individualized to your preferences, to your culture. We do see that in the research, there are some plans that stand out as far as like having good research and showing other benefits like cardiovascular benefits or blood sugar control benefits. And those are things like Mediterranean, DASH diet, which is dietary approaches to stop hypertension, lower carb, lower fat, volumetric diet, which is actually a diet that is based on having lots of volume from whole foods, like whole fruits and vegetables. So you get that satiety or those stretch receptors in your stomach, basically showing that you have more volume, but with lower calories. High protein, vegetarian, which actually vegetarian tends to be a high carbohydrate plan, but it's also, when done well, it's a high fiber and high phytonutrient plan. So, there's lots of different plans out there that can work. So you got to think about what are your preferences? What's your culture? What do you like? What is important to you? If it's important to you to not eat animal proteins, this can be done in a vegetarian style. That is possible. There actually has been research showing that some meal replacements are effective. So like a meal replacement shake, for example, for one of the meals, especially if you're not a breakfast person, for example, that could be an option and has been shown in the research to be effective. Low calorie diet, very low calorie diet. So that would be like less than 1,000 calories a day. It is an option for certain patients who are under high supervision, medical supervision, where we're checking things like, checking for gallbladder issues, because with, rapid weight loss, you are tending to have more issues with gallstones, kidney stones, muscle loss, electrolyte imbalances, all of those things. But for some people who the pros and cons, when you weigh those and look at like the risk and the benefit, they're at such high risk that they really do need to do something more drastic, and then they should be medically supervised. From a physical activity sense, the recommendation is basically right along with the physical activity guidelines for Americans, which is 150 minutes of moderate exercise or moderate cardiovascular, getting your heart rate up per week. That's minutes per week. and at least 2 different bouts of resistance exercise. 3 is better, but at least 2. Reducing sedentary behavior, and then individualizing a program to your preferences. And of course, taking into account physical limitations, what's going on with you. And you might need someone very specialized for that, potentially like a PT. And then behavior-wise, we do see some interventions being very helpful, like monitoring of food intake. For some people, that is very helpful. It's that awareness piece. For other people, it's really not appropriate because it's going to spin them into being obsessive about it. But for some people who are just like, I have no idea what's going on and what I'm eating and how much, it can be a nice educational tool and then something to work on and look at together with your dietitian. Definitely goal setting, which we'll get to tonight. Education, you're showing up here tonight, so you're getting some education. Stilly Valley has other classes coming up this year. In fact, we have a 3-part series for people with diabetes or pre-diabetes that will actually be in person this year, which is kind of fun. So we'll have a face-to-face meeting. So that if that applies to you, come sign up and show up to those classes. It'll be starting at the end of February. Problem solving strategies. So, you run into a roadblock and how do you figure out how to address that? Like maybe the exercise isn't happening and, we need to bring in this like behavioral aspect of problem solving to figure out how you get back to the gym. Other things like stress reduction, counseling, cognitive restructuring. So changing some of those, like that language in your head, changing some of the like maybe automatic negative thoughts that can happen. There's a lot that can be done from a behavior sense. Okay. Here are some successful behaviors from people who are not in a clinical trial. This is like real world living their lives people who have submitted their information to say, hey, this worked for me. This is the National Weight Control Registry data that's been around a very long time now. And the successful losers have lost an average of, the last time I looked at it, it's probably more than this at this point. The last time I looked at it, it was about 70 pounds and had maintained that weight loss for over 5 years. And this is what they were doing in their real day-to-day lives, not in a structured clinical trial. They're eating fewer calories, so there's an energy deficit. They're eating breakfast every day, the majority of them. Maintaining a consistent eating pattern, self-monitoring for weight, keeping food journals, watching less than 10 hours of TV per week, and exercising on average about an hour per day. And that's for maintenance, right? That's for maintaining the weight loss. Most of them are not doing anything fancy. They're walking. It's the number one thing. But again, that's for maintenance. That's not necessarily for loss, right? With exercise, you would have to do a lot more than that to see loss from just exercise alone. Usually you have to do these other things as well. Dietary intake changes, awareness, less sedentary behavior, not just exercise, but also more non-exercise activity thermogenesis, like more of that NEAT calorie burning. So, the people who can't sit still and are always moving, we know that that burns more calories. So it's not just exercise, it's also reducing sedentary time. So sitting in front of a TV, for example. So think about, what levers could you pull in your life from this list? Maybe jot some of those down. Okay, and then we've known this for a while. This study was back in 2010, and we actually have so many more technology-based, like apps, for example, programs nowadays that this has just kind of exploded, and especially the last 5 years since the pandemic. We have a lot of options for having a feedback loop via, our fingertips for most of us if we have a smartphone. And that can include things like self-monitoring. It can be check-ins with a coach or a counselor. It could be group things like meetups or like Facebook, meetings where there's social support and people who are in your same boat, where you can get peer-to-peer support. There's a lot of structured programs out there, like the Weight Watchers, for example. And they are doing some individual tailoring even. So they'll look at, for example, height, weight, age, gender, activity level, your weight loss goals, give you some goals as far as calories or points, or even goals as far as like, so many cups of fruits and vegetables per day. So, it's some really good information, even if you're not necessarily seeing a person in person, these have been shown to be effective. And for some people who are really busy or who don't need that, in-person face-to-face time, this can be a nice strategy. I know some of my patients like to just come in just to like be here and be in person. And if that's you, then of course, find somebody who can support you that way. But it doesn't have to be that way. It can also be, online. Okay, here is a number one pitfall that I see in my patients who come in who have not been successful in the past, and that is having unrealistic expectations. And then when we don't meet them, we tend to give up. Also, I see a lot of times with people who have been on this like a yo-yo diet thing where you're going from one diet to the next, there may be loss on the diet, which when it's, a fad diet, it's not realistic, it's not sustainable. So they're on it for maybe a couple weeks. But then when you go off of it, there's weight regain. But a lot of times it actually isn't just back to the starting weight, it's oftentimes more. So they lose and then they gain above to where they started from. And that has to do with the unrealistic expectations of losing too fast and losing muscle. Muscle is the most metabolically active tissue, and ideally we want to be increasing muscle, not decreasing muscle. But if you're, on a fad, super restrictive thing where you're losing so fast that you're losing muscle, that's where people get into this stair step up over time. And unfortunately, the kicker with this is that people feel like it's their fault. And it's not your fault, it's the diet's fault, right? It's the unrealistic expectations to begin with that set you up for failure. But there's this sense of like, oh, but it worked. And so people go back, and try it again, or try, the different horse, but you're still on the same merry-go-round. And usually what happens is over time, it's just climbing in weight. And it's not the right kind of weight, right? It's fat gain, muscle loss. We really want that to be reversed, ideally. So we really got to get out of this like short-term quick fix mentality and think about, okay, how long did it take for this, to get to this point? Probably decades. Healthful weight loss is going to take time, and it really should take time in order for you to not be losing too much muscle and for you to be doing it in a way where you're putting in sustainable changes to your lifestyle that actually then support keeping it off, right? So here's the NIH guidelines, and their recommendation is somewhere between 5 to 10% weight loss. Now, this is higher. Remember that first overview where I showed you that 3 to 5% had clinically meaningful improvements in blood pressure and lipids and blood glucose. So even at 3%, you're going to have clinical, meaningful impacts on your health. From a weight loss rate sense, the NIH says you can do this healthfully around 5 to 10% within a 3 to 6 month window. So let's just talk about what that means. For people who are in that overweight BMI category, like 25 to 30, that's like a half a pound to a pound a week. You might not even see that amount on a scale if you're checking in a week, right? So the daily checking sometimes actually is not recommended because that can be very discouraging and you're seeing this like water fluctuation thing happening. And if you're only going for half a pound to a pound a week, you might not even see that change in a week's time. Maybe you really need to like only be checking it every 2 weeks. Um, or not at all if you're obsessing about that number, right? And for people in the BMI category of 30 and above, it's 1 to 2 pounds per week. And again, that is because we don't want it to be too much muscle. Now, if you factor in plateaus, it might be a little bit longer than the 3 to 6 months because they also say, oh, plateaus are a good thing, right? And if we don't see a plateau, if people are just going straight down, usually that's when they go straight back up. We want to have this like stair step. And that is very normal and healthy, but a lot of times people get to a plateau and then kind of freak out. Just give yourself some time, give yourself some grace, let your body set to that normalization of that lower number. Keep doing your behaviors. Maybe we make a tweak. Maybe we make a tweak to your diet. Maybe we make a tweak to your exercise. Maybe we make a tweak to your behavioral strategies just from a consistency perspective, right? To then continue that trajectory. But I think what you should do right now, if you've got your pen and paper, is do your own math on this, right? So if you are going for somewhere in that 5 to 10% range, what does that mean for you? Here's an example. So for someone at that 200-pound range, 5% would be 10 pounds in 3 to 6 months. So that's a much different expectation than what you hear from influencers or what you hear in radio ads. 7% would be 14. The 10% would be up to 20, right? Okay, so you can do your own math on that and kind of reset, like what is considered a healthful rate. Okay, and then besides that, I would think beyond the scale because oftentimes, metabolically and health-wise, you are making improvements even before the scale starts changing. Like if you're doing more fruits and vegetables, if you're doing less sugar, if you're doing more exercise, sometimes even with exercise, the scale will go up, right? Because you're putting on muscle. So that can feel discouraging. So you've got to think about like what are the other things that you can track besides just that number on the scale. And also, that number on the scale doesn't tell you what kind of weight. It's not telling you is it fat, is it muscle, unless you have a fancy scale. So if you've got a fancy one, that's great, where it kind of breaks it down for you. But I would think beyond the scale, like think about your energy, think about your sleep quality and length. Think about, are you less inflamed? Are you moving better? Is your mobility better? Improvements in dietary intake, like maybe, expanded into those vegetables, for example. Improvements in things like strength and fitness, like maybe it's easier to take the stairs or you start noticing that your walk with the hills is getting a little easier over time. All of those are really healthful wins that you do want to celebrate and recognize so that you actually get that positive feedback and you know that you're on the right track with things. And then, of course, we have metrics. If you're getting your labs, we can check things like glucose or an average blood sugar, like an A1C. We can look at your lipids, like your cholesterol and your triglycerides. You might be checking blood pressure at home and seeing some improvements in that. In fact, I would say, just as a little warning for people, if you're on blood pressure medication and you start making some of these changes, you start getting to the gym, maybe you're doing more vegetables, maybe you're doing a little less eating out, so less salt, maybe you have a little bit of weight loss. It is very common to all of a sudden become over medicated. So be on the lookout for, those symptoms of like hypotension, dizziness, wooziness. When you change postures, like you go from sitting to standing or from laying down to sitting, if you're feeling that like woozy, low blood pressure feeling, oftentimes people get over medicated and we can potentially like bump those medications down over time as you are making these changes and you need less of them. And for some of my patients, that's actually a really big goal of theirs is to get off their medications. And it is very possible. I've seen that happen. Okie dokie. Just checking the chat really quick here. But yeah, let's make it visual. Let's celebrate it. If you can, have a graph or have a chart or have a sticker that you give yourself for your exercise days, whatever is going to make it where you really see it and you get that feedback, that can be really helpful for staying the course. And if you have any ideas for that, go ahead and put that in the chat. Like if you have a special app or a way that you're tracking, that could be helpful for other people to see. Okay, pitfall number 2, and I see this all the time. It's an all or nothing mentality. In fact, I just had my last patient today was like, I'm just all or nothing with exercise, which is very true of exercise for a lot of people. It's like we think we got to get to the gym for an hour or we do nothing at all. Instead of realizing that like every little bit adds up and we want to be putting in the little bits because the little bits over time add up into, bigger things. And actually we have research showing that exercise snacks, you can just go to PubMed and look up exercise snacks. There's quite a bit of research now on 1 to 2 minutes after meals having significant impacts on blood sugar, blood pressure, and cholesterol. I mean, who would have thought that that small of a change, where instead of just sitting right away, you're going and doing stairs, or you're doing squats, or you're doing your wall push-ups in tiny bite-sized pieces is actually going to make a difference. But we see in the research that it does. So we got to get out of this like all or nothing mentality and also, that perfectionism thing, because that's where I see people throwing in the towel and either like being on or being off, being on or being off. 80/20, grace for yourself, and progress, right? Progress in the right direction. Okay, and this is especially true of exercise. The number one recommendation from the physical activity guidelines for Americans is avoid inactivity. It's not even like, you got to get to the gym 3 times a week. It's stop being so sedentary, right? So like get up after dinner and do the dishes and, do some vacuuming and walk to the mailbox and then maybe sit down, but do something versus nothing. And if you can activate your life where it's built in to your day, even better. So you kind of see like these people taking the escalator to go to the gym. Take the stairs, park farther away. It's all those little things. Sometimes I'll do like multiple, up and down the stairs for laundry day. I'll do multiple trips instead of just one big trip. Or same thing with the groceries. Do multiple trips and do your pearls on the way in with your grocery bags or whatever. But we do a lot of sitting these days. A lot of us have desk jobs. We've got a lot of, contraptions that do all the work for us, dishwashers and vehicles and remote controls. So if you can break up your sitting time, that is a really good thing. And it's not just about, the calories burned while you're moving. It literally changes your hormones. So, less of that cortisol, for example, when you're trying to move throughout your day. There's this recommendation or kind of a guideline for every 30 minutes of sitting, try and move for 3 minutes. So if you need that as like a mental guideline, that's a good one to try and aim for. And then we already talked about the 150 minutes of moderate intensity activity during a week. That could be broken up like 20 minutes over 7 days, or 30 minutes over 5 days, or 50 minutes over 3 days. Doesn't really matter. In fact, you could break it up smaller. You could do 10-minute chunks, right? But just that total, we do see that's where the curve of morbidity and mortality, so death and disease, really drops off when you're meeting that 150 minutes a week. So it's a good goal. Okay. I cannot overstate how important muscle is for this whole process, not just like weight management, but your health span and your longevity, not just length of years, but like health of those length of years, right? I just learned this statistic, I think yesterday, that there are 21 trillion mitochondria in 1 pound of muscle. And if you've had Bio 101, you'll remember mitochondria are our little powerhouses that make energy. They are the metabolism center, right? That is where we are producing energy. So 1 pound of muscle loss, which we are losing muscle over age 30, that's just a typical thing, a natural process that will happen if we don't fight it. 1 pound of muscle loss, you're losing 21 trillion mitochondria that are basically, your metabolism. So, conversely, think about that. 1 pound of muscle gain is 21 trillion mitochondria that are helping you with not just metabolism, but other processes as well. So it's really important to focus on your muscle. And anytime you're focusing on your muscle, where you're doing that like strength or resistance exercises, that also puts strain on your bones. So it's a win-win. Like it's a double whammy, right? Like you get both the muscle and the bone health out of it. So this is the piece that a lot of people are missing or just haven't figured out how to do, or they don't like it, or they think they don't like it, but they don't really know. Because once you start doing strength training, it's kind of addicting. I used to be more like a cardio person, and now since perimenopause, I'm like, oh my gosh, I need to be doing my strength training. It makes a huge, huge difference. And long term, it's going to make a big difference in your trajectory of things like fall prevention and your quality of life later in life. So really, really important. At least 2 times a week is recommended by the physical activity guidelines for Americans, but 3 is better, is what they say. So 2 to 3. And you don't need anything fancy. You can just use your own body weight for resistance. So it could just be, squats, wall push-ups, sit-ups. Okay, so check-in time. What are the ways that you are moving your muscles? What are ways that you can just activate your lifestyle, like do more with your, day to day? How do you fit in the extra steps, the extra movement? And are you doing something that you love? Like, have you found something that you really enjoy that is an active hobby or an active, engaging activity? And if you don't have that, you probably need to take some time to brainstorm that piece of things. All right, let me look at. Oh, great. So Meg says, I like playing pickleball and swimming. Yeah, yay. So good. That's good cardio. It's good for respiratory fitness. Swimming is like full body, the pickleball too, full body, and social, which is really nice. Love that. Okay. Let's just briefly touch on nutrition medication interactions. So we do have 3 main categories of medications out there to help with weight management. One is basically a fat inhibitor that blocks fat absorption. And so the nutrition downside of that is potentially fat soluble vitamin malabsorption. And your fat soluble vitamins are D, which we already have a hard time with here in the Northwest, D, A, E, and K. Also, fat malabsorption diarrhea, because if you're malabsorbing fat, usually that will cause some diarrhea. So then you can also have some like fluid and electrolyte imbalances with it. So if you're on this one of these lipase inhibitors, do be careful about that. And you probably want to see a dietitian to talk about, losses and make sure that you're staying hydrated and all of those good things and keeping your fat soluble vitamins up. Appetite suppressants, we have quite a few of them. The negative or the con on that is potential for increased blood pressure. And then actually, I see it's often used in people who already have low appetite. So sometimes they can be used inappropriately. Like for my patients who are skipping breakfast and lunch, they don't need an appetite suppressant at breakfast. They're already not feeling it. We actually need to get them back in tune with hunger cues. So some of these are really, in my mind, not appropriate for certain people. because we actually want to get them spacing intake over the day, not just suppressing and doing that gluconeogenesis thing where you're losing muscle and making sugar. Um, and, oftentimes if they're taking them in the morning and then that thing is wearing off by night so that you can sleep because it's a stimulant, then it's not working at the time that you want it to work anyway. So, you got to work with your primary care or whoever's managing this for you. Like, make sure it works and is doing what you think it's supposed to be doing. And then, of course, there's some GI distress with some of these. And then the big kids on the block these days, GLP-1s, GIPs, you've heard of them, like Ozempic and Wegovy. Basically, the two out right now that a lot of people are taking, the semaglutide and the tirzepatide. But these have been around for 20 years. Our first GLP was GLP-1 incretin mimetic was approved by the FDA in 2005, and we've used them for a long time in diabetes. So they've been around for, managing blood sugar for over 20 years at this point. They work really, really well. And we know that people who have diabetes and people who have obesity actually have less GLP-1s. It's a hormone you should be making in your gut naturally, but some people just are not making as much. That's a whole other, talk about like how do we increase that and how do we address that environmentally, because it's a gut health issue, right? But these are hormones that we should be making that travel through the body that do all kinds of things that help with weight management and blood sugar control. The downside is it slows gastric emptying and can cause some constipation, although I have seen them cause the opposite with a few people, so diarrhea. And then just like any fad diet, if you are losing weight too fast, you can be losing more muscle and bone. Same thing on these GLP-1s. If you're losing it too fast, more of that percentage is going to be more muscle and bone density loss. So we don't want that to happen. So we do want to make sure that your rate is still appropriate to those NIH guidelines. And then the other thing with GLP-1s is sometimes people not just because it helps with the food cravings and like the food noise, but sometimes it's not just suppressing that, it's also suppressing thirst cues. So then I see some of my patients coming in dehydrated because they're not drinking enough water. Okay, so that's a little brief overview. From a food sense, we really want to be focusing on what to increase. And these are the things that people are missing. This is what most people tend to be missing. And if we're focused on the increase, on the positive, that is naturally going to displace some of those other things. So we don't have to be so negative and so restrictive and thinking about, oh, I can't have certain things. If you put in enough fruits, vegetables, beans and lentils, nuts and seeds, whole grains, protein at breakfast, more home cooked meals, lots of color, more variety, more water, you're not going to have that deprivation mindset, and you're going to be, well nourished as well. And it's not just about like nourishing you, it's about nourishing your microbiome. So all of those gut bugs, that whole complement, it's not just bacteria, it's other things like yeast, for example, that are doing the work for you, but you need to feed them well in order to have good weight management, anti-inflammatory components that they're creating, and these benefits of things like lower cholesterol and better blood glucose. But you got to feed your microbiome well. So it's not just about feeding yourself, it's about feeding the trillions and trillions of gut bugs that you have. And that is, basically one of the aspects of why these GLP-1s are working is because we have low production of them because our gut microbiomes are not being fed well. And so when we give it exogenously, it's like, oh, this is what we were missing hormonally that we should be making through feeding ourselves and our microbes lots and lots of fiber and color. Okay, so to do that, ideally you're setting up your environment. It's a seafood diet. Whatever you see first, you're more likely to choose. So make sure that you're seeing those things that you're missing. You're seeing the vegetables. Maybe they're already prepped and cut up and ready to go in clear containers at eye level. You've got fruit on the counter. You have a plan for protein at breakfast. You've got healthy snacks that you're packing and bringing to work. All of those, like, setting yourself up for success so that it is a smart but like easy choice. Convenience really does matter for sticking with this and for making it so that the smart choice is the healthy choice. Okay. We do want to think about your mindfulness as well, so that we're not just eating past fullness. Because sometimes you can, even with like real whole healthy foods, you can still, eat past that fullness. It's harder to do because you've got more volume, got more fiber, you've got more nutrients there. Um, but if we're super stressed, we're distracted because we're watching the TV, we're in a meeting, we're running and on the go, we're eating in the car. It is very possible to, eat past that fullness marker, and then we get that sensation a little bit later. And this is especially true for like fast eaters. So if you can slow down, chew your food well, have a conversation, put the fork down, what we're aiming for is about an 80% full, not 100% full, but like 80% where you're satisfied and you're going to be fine until the next meal or the next snack because you've got hopefully a structured plan over your day. But we don't want to go past that 80 because then really it is, you're basically too full by the time you realize it. And it does take that 20 minutes from the stretch receptors to then send the signal to the hypothalamus that you have had enough. Um, Definitely, from a social support side of things, you want to have people that are supporting you, that are positive, that are role models. You can look at, the five people, they say the five closest people around you, look at them, and that's basically who your personal influencers are on your life, right? Have exercise buddies. Maybe a motivator for you is an online app or like the Fitbit or Garmin or smartwatches. Maybe it's a professional, a registered dietitian, an exercise physiologist, or a PT, um, psychologist or counselor. Those could all be part of your toolbox. And then we really want to focus on the behaviors you can control. So remember that weight is an outcome. Weight is not something you do, right? It's not a behavior. You go to the gym or you don't go to the gym. That's a behavior. You eat your vegetables or you don't eat your vegetables. That's a behavior. Weight is an outcome. So it's okay to set that as an outcome goal, but it's not a behavior goal. When you're setting goals, we really want you to set something that you can control, right? So you can control your activity. You have control over type, amount, timing of food. For the most part, some people, might not have as much control as others. Um, Addressing sleep disturbances. We aren't really going to go into this, but like if you have a sleep disturbance, like sleep apnea, that's going to make it really difficult to lose weight. So you want to address that piece of the puzzle. Managing your stress. If you're constantly in fight or flight mode, is going to make it hard to lose the weight because that cortisol puts weight around the center. That's what it does. And the body goes into protect mode when you're stressed all the time, and it's harder to lose weight. So some of these things that seem maybe a little bit like peripheral are actually very central, like stress and sleep, to this, overall big picture with weight. But focus on what you can do. And of course, you've probably heard about SMART goals. So we want it to be specific, measurable, attainable, relevant to your outcome goal, time-based, so you set kind of like a deadline for yourself, or you have an amount of time that you're doing this goal within. But I would break that down even further. So if you take the, behavior and you set your goal, like let's use exercise as an example. I want to get to the gym 2 times per week, or I want to do my strength exercises. I'm going to say this for myself because I don't go to a gym, I do it at home. Strength exercises at least 2 times a week, ideally the third time, but really realistically for me right now, it's 2 times a week. But in order to, get there, there are things I have to set in place first. And I have kind of been doing that. I've got my weights, I've got my resistance bands. I now have a gal that I watch on YouTube for free that I really like. Her channel is called Fitness with PJ. She's funny. I can go on there and in half an hour I can get a strength exercise done. And she's actually like a personal trainer who really does personal training. She's not just bopping around playing music. Um, so, I kind of have my things set up, and then my days are Tuesday and Thursday because my cardio days are Monday, Wednesday, Friday. So tonight I haven't done my strength stuff yet, so I'm gonna have to go do it tonight. Um, so I know when, I know where, I know what, I know how much, I know, the days that it's happening. And then once you have all those steps, then you take the first step, which sometimes that is the hardest part, right? So I would think for you, like, what are the things that need to be put in place in order for you to take that first step? Sometimes there's a lot of, we call it like before the action phase and between contemplation and action, you're basically preparing. It's the preparation phase of making behavior change. You might be there getting set up to make that change. So write down, your goal and then those action steps that need to happen in order to meet that goal. Meg is asking in the chat, I am reading the book Intuitive Eating. How does that fit in? Yeah, so intuitive eating is getting into those cues with your body. So it's not about restriction, it's not about the food police, it's about honoring your hunger, getting into normal like patterns of hunger. Sometimes people have hunger silence from medications, stimulants like smoking and lots of caffeine, so nicotine and caffeine, and stress, right? So if you've got hunger silence, you want to think about what's going on there and address those things. And it's about getting off the diet merry-go-round. So you're not just like hopping from horse to horse. You're really like putting food back in, but then thinking about what really fits your goals, what makes you feel good, what gives you the energy, what is helping with your overall health. So it's kind of like an anti-diet, like anti-restrictive diet approach. Yeah, that can totally fit. Okay. And then I would break up your year. If we're kind of starting this in January, if you're thinking big picture, like a year out, break that down into smaller, more bite-sized goals along the way. What about for the next week? What about for the next month? What about for the next quarter? And then maybe I'll see you here again in 2027 and you can tell me about your goals. Or maybe I'll see you in person, if you need that support. Also, I would check out the Stilly Valley Health Connections website because we've got in-person cooking demos. We have that series coming up in February. We've got a heart health class that I'm doing in February as well. And then some other, one-off classes on nutrition and health that might be of interest to you this year. This weight management talk, it is the tip of the iceberg. I realize that, but we only have an hour, right? So, but it is the tip of the iceberg as far as like where you start. But some of you are there already. Like you're doing all of these things, right? And if that's you, then I would say get individualized support with a registered dietitian because there's a piece of the puzzle that's missing. It could be low nutrients, which sometimes, that includes putting in more calories even. Like I've had patients that needed a higher calorie intake in order to support their metabolism because they were so low on things like magnesium and B vitamins, but they weren't able to lose the weight. Um, sometimes it is supporting the gut microbiome so that, the good bacteria, the good guys are helping you with the inflammation and the weight management. So, don't feel frustrated if you're already doing all these things and you feel like, oh, I'm doing all this. Great. That's amazing. such a good place, and get the support, the individualized support that you need, so that you can continue the journey and not just feel frustrated and throw in the towel. Okie dokie. Any last questions or comments? Thank you all for being here. I wish you an amazing year, amazing 2026. Let's go. Yeah. Okay. All right. Take care, everybody.